Today, I have the honour of speaking with a very special guest. Joseph is a survivor of multiple cancers, but today he joins me as a survivor of pancreatic cancer, thanks to a clinical trial funded right here in Perth, thanks to Warpnine charity. Joseph, not many people can say they've survived pancreatic cancer. Tell me, how grateful are you to have been asked to take part in this trial?
So the bottom line is, without this trial, the clinical trial that Warpnine has offered me, I wouldn't be here. I'd be long gone, because the statistics are the first year after diagnosis of pancreatic cancer, you're gone. So I'm very thankful for Warpnine, and I'm very happy to participate in clinical trial, knowing that down the road, in the future, I could be offering somebody else a cure for this devastating disease.
So take us back now to your diagnosis. How did you know you had pancreatic cancer?
The thing about pancreatic cancer is that the symptoms are very subtle. I felt well, I wasn't losing weight, but I had some indication that I had an issue. I had pale stools and my urine was very dark. I went to my GP and had a blood test, and my blood test came back and my bilirubin levels were very high. Normally, I'm not sure, maybe 25 or 30 parts per whatever it is. Mine were 1,200. So they were off the chart. So my GP called me back and said, "You need to come see me tomorrow." He made an appointment. And he said he booked me in for a CT scan straight away. And that's when they saw that, yes, I had a problem. To get a diagnosis of pancreatic cancer is probably one of the worst things you can receive from your doctor. So devastated, but you've got to have that can-do attitude. So, okay, what's next? What do I have to do? So you set your mind to the fact that it's going to be a long journey, a difficult journey, but you have to have that mentality of what's next.
So talk us through the diagnosis and how you got involved with the clinical trial.
So my GP referred me on to a specialist, and I went to see Dr. Johansson at Charlie Gardner's. And he broke the bad news to me. He said, "Well, I'm sorry to inform you, but you've got pancreatic cancer." Now, I'd already had an indication that I had that because I had my CT report. The pancreatic cancer has a fearsome reputation. I don't know of many other cancers that are more virulent, brain cancer, I think, and I'm not sure other cancers are worse, but pancreatic cancer has a very bad reputation.
So tell me about your experience with the clinical trial.
When I went to see Mr. Johansson at Charlie Gardner's, he offered me a clinical trial. I foolishly said, "Oh, well, I live very far away. I don't want to have to come all the way to Subiaco." So I went home and did my research, and I found that clinical trial patients, they do very well. Even if they're not getting the clinical drugs, you get a gold standard of care. So I very quickly emailed Mr. Johansson and said, "Oh, please enroll me in this clinical trial, because I'm very interested in participating in it." The clinical trial helped me, and more importantly, I helped other people, because this drug that is being tested, it's got a very good success rate. It looks like it's effective. It looks like it works. So I think in the future, we're going to have a cure. This may be what we need to have a cure for pancreatic cancer. So this clinical trial is the ILISTA trial. And the ILISTA trial is a novel approach. It's using a nanotechnology to deliver the chemotherapy into the tumor. Now, pancreatic cancer is very hard to treat because the tumor is encased in like a hard shell, kind of like a peanut. And standard of chemotherapy normally doesn't penetrate this hard shell. So the ILISTA trial is using a peptide. It's a nanotechnology to deliver the chemotherapy into the stroma and to attack the tumor. So when you're diagnosed with a deadly disease, such as pancreatic cancer, all you have left in life is hope. And hope is what this clinical trial gave me.
So how do you feel today?
Today I feel great. I've got my health back, I've got my hair back. I'm still very thin. I've lost about 10 kilos. At one stage I lost 15 kilos. That's from my surgery. I had a Whipple procedure, very intrusive into your stomach. They cut bits out. So after my Whipple procedure, I had trouble with eating. You know, I had to be very careful what I eat. I lost a lot of weight, but now I've gained a few kilos back. I feel great, and you know, I'm just happy to be here, really.
So what would be your advice to someone else who might be contemplating taking part in the trial?
If anybody out there is offered a spot in a clinical trial, accept it without hesitation, because first of all, you're getting the standard of care that you will receive anyway, but you've got a chance to trial some new drugs. You can help other people in the future. This drug that was trialed is very effective. I mean, the statistics that are coming out are very encouraging. So this might be a breakthrough in fighting this very deadly disease. I would say to people that have been diagnosed with pancreatic cancer or other GI cancers to, yes, get involved in a clinical trial. If you're offered a clinical trial, don't hesitate. Grab at the opportunity, because it saved my life. I mean, I'm coming up to 2 years now, and most people are gone within a year of a diagnosis of pancreatic cancer, because it is so deadly. So I'm very thankful to Warpnine, Dr. Dean, all my medical staff that have helped me through this journey, because it's a long, scary journey. And, you know, without these novel new technology, these breakthrough drugs, pancreatic cancer is pretty much a death sentence.
So how grateful are you that a charity like Warpnine exists here in Perth?
I'm very thankful to Warpnine for all their hard work, and to all the people that donate generously. Warpnine is a charity that needs donations in order to run and to be able to offer hope. The main thing about a cancer diagnosis is that you have to have hope. You need hope in this game, and without hope, you've got nothing.
In Australia, the 5-year survival rate of pancreatic cancer is just 12.5%. You're 2 years into your journey and you're already in remission. How does it feel knowing you've beaten the odds?
You know, to find out that you're in the clear and you've got possibly, you know, a couple more years of life, well, it's just the best feeling in the world. You go through all the complications and all the trials and tribulations to get to where I am. And, you know, I wouldn't be where I am without Warpnine. Dr. Dean, all the surgeons, all the medical staff has just been great. I mean, I'm just thankful that I'm in Australia and getting the best care in the world, you know, and otherwise I don't know where I would be right now. 18 months I've had chemo and surgery and more chemo. I've had a CT scan probably just after Christmas, 2024. And I've just received the good news that, yeah, I'm still clear, my scan's clear, and my bloods are good. So, yeah, I'm in the clear. I've got another 6 months of life.
Joseph, thank you so much for sharing your story with us today, and thank you also for helping shape the future of pancreatic cancer treatment.